Have you ever wondered how prevalent diabetes is in our society today? As we speak, diabetes is a global health challenge affecting countless lives. This chronic condition is characterized by high blood sugar levels, often due to the body's inability to manufacture or utilize insulin efficiently. Primarily, there are three types of diabetes that we encounter: type 1, type 2, and gestational diabetes. Type 1 diabetes, usually diagnosed in children and young adults, is an autoimmune condition where the body fails to produce insulin. On the other hand, type 2 diabetes is more common and occurs when the body becomes resistant to insulin or doesn't produce enough. Gestational diabetes, as the name suggests, affects pregnant women without a previous history of diabetes. Each type of diabetes has its unique characteristics, symptoms, and treatment approaches, which we will explore in depth. In the next few minutes, we will delve deeper into these types of diabetes and their treatment approaches. First, let's uncover the mystery of type 1 diabetes. This form of diabetes, often diagnosed in children and young adults, is an autoimmune condition where the body mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Without these vital cells, the body is unable to produce enough insulin, a hormone that helps glucose from food enter cells to be used for energy. The symptoms of type 1 diabetes can develop quickly, sometimes over a few weeks. They include excessive thirst, frequent urination, unexplained weight loss, constant hunger, and blurred vision. If you or someone you know experiences these symptoms, it's crucial to seek medical help immediately. Early detection can help manage the condition better and prevent complications. Now let's talk about the lifeblood of type 1 diabetes management: insulin therapy. Because the pancreas cannot produce enough insulin in people with type 1 diabetes, they must rely on insulin injections or an insulin pump. This therapy helps maintain normal or near normal glucose levels, reducing the risk of long-term complications. In the early days, insulin injections were the only option, and they required a strict schedule of meals and physical activity. But with advancements in technology, we now have more sophisticated delivery methods. Insulin pumps, for instance, mimic the way a healthy pancreas works by delivering small doses of insulin throughout the day. And then there are insulin pens, which are more portable and convenient than traditional syringes. Furthermore, the development of fast-acting and long-acting insulin types has allowed for more flexibility in insulin administration and, consequently, in the daily lives of people with type 1 diabetes. These advancements not only make insulin therapy more manageable, but also help individuals with type 1 diabetes lead a healthier, more normal life. Managing type 1 diabetes involves a combination of early detection and effective insulin therapy. Remember, type 1 diabetes is a serious condition, but with the right treatment and care, people with this disease can live long, fulfilling lives. Now let's shift our focus to type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way your body metabolizes glucose, the fuel that powers your body's cells. Unlike type 1 diabetes, where the body can't produce insulin, in type 2 diabetes, the body either resists the effects of insulin or doesn't produce enough insulin to maintain a normal glucose level. The risk factors for type 2 diabetes are multifaceted and can range from genetic predisposition to lifestyle choices. A family history of diabetes, a sedentary lifestyle, and obesity significantly increase the risk of developing this condition. Your ethnicity and age can also contribute to your risk profile, with certain ethnic groups and older individuals being more susceptible. The symptoms of type 2 diabetes are often subtle, and many people might not even realize they have it. These can include increased thirst and frequent urination, increased hunger, weight loss, fatigue, and blurred vision. If you're experiencing any of these symptoms, it's important to seek medical advice, as early detection is key in managing the disease. Diagnosis of type 2 diabetes usually involves a series of blood tests: a fasting blood sugar test, an oral glucose tolerance test, or a hemoglobin. A1C tests can all be used to determine if you have diabetes or prediabetes. Once diagnosed, managing type 2 diabetes often involves lifestyle interventions. This includes adopting a healthy diet, increasing physical activity, losing weight if necessary, and quitting smoking. These changes can significantly improve blood sugar control and can even reverse the progression of the disease. In addition to lifestyle changes, medical interventions such as oral medications or insulin therapy may be necessary. These treatments work in various ways to lower blood sugar levels, such as increasing insulin production, decreasing glucose production, or improving insulin sensitivity. Lifestyle modifications play a crucial role in managing type 2 diabetes. It's about creating a balance between food, exercise, and medication to achieve the best possible health outcomes. Remember, every step you take towards a healthier lifestyle is a step towards better managing type 2 diabetes. Gestational diabetes is another type of diabetes that requires attention. This form of diabetes emerges during pregnancy and affects both the mother and the unborn child. Although not permanent if left unchecked, it can lead to complications. Gestational diabetes occurs when the body struggles to produce enough insulin to meet the increased demands of pregnancy, leading to higher blood glucose levels. It's vital to know that this condition doesn't just affect the mother. Elevated blood glucose can cross the placenta, causing the baby's pancreas to produce extra insulin, which can lead to macrosomia, or a fat baby. The good news is that with careful monitoring and management, the risks associated with gestational diabetes can be significantly reduced. This includes regular blood glucose checks, a balanced diet, and regular exercise. In some cases, insulin injections may be necessary. Taking care of gestational diabetes ensures the health of both mother and baby. It's a temporary condition, but it needs your full attention. Treatment of diabetes varies depending on its type. For type 1 diabetes, which is an autoimmune condition, the cornerstone of treatment is insulin therapy. This is because the body's own immune system has destroyed the insulin-producing cells in the pancreas, leading to an insulin deficiency. Insulin can be administered through injections or insulin pumps, with advancements in technology now even offering continuous glucose monitoring systems that can adjust insulin levels automatically. On the other hand, type 2 diabetes is often initially managed with lifestyle changes and oral medications. This form of diabetes is characterized by insulin resistance, where the body does not use insulin effectively. Therefore, treatment often focuses on improving insulin sensitivity through diet, exercise, and medications designed to lower blood sugar levels. If these measures are insufficient, insulin therapy may also be required. Regardless of the type of diabetes, regular monitoring of blood glucose levels is crucial. It helps individuals understand how different factors like food, physical activity, and stress affect their blood sugar. It also informs the adjustment of insulin doses or medication to maintain optimal blood glucose levels. While medical treatment is vital, lifestyle management plays an equally crucial role in diabetes care. A balanced diet, rich in whole grains, lean proteins, fruits, and vegetables, can help regulate blood sugar levels. Regular physical activity, whether it's a brisk walk, swimming, or cycling, can improve insulin sensitivity. It's also important to manage stress effectively, as stress hormones can cause blood sugar levels to rise. Remember, a healthy lifestyle is a cornerstone of diabetes management. Regular checkups, consistent medication, and a balanced lifestyle can help manage diabetes effectively and prevent complications. It's about taking one day at a time, making small changes that add up to a big difference. So let's take that step today towards a healthier tomorrow. Living with diabetes requires education and support. As we navigate the road of managing this condition, let's remember that knowledge is power. Understanding the ins and outs of diabetes, its symptoms, and the ways to manage it empowers individuals to take control of their health. Healthcare professionals play a significant role in this education process, providing essential information, answering questions, and guiding patients through their treatment journey. However, support doesn't stop at the doctor's office. Various support groups and online resources are available, offering a community where individuals can share their experiences, learn from others, and gain encouragement. Now, living with diabetes isn't without its challenges. It requires daily management, regular checkups, and lifestyle modifications. But with the right support and education, these can be effectively navigated. Looking ahead, there's a lot of exciting research in the pipeline. Scientists are exploring innovative methods to improve diabetes treatment and prevention. From advancements in insulin delivery methods to the development of an artificial pancreas, the future of diabetes management is promising. The road may seem daunting, but remember, you're not alone. With the right education, a strong support system, and the courage to face challenges head-on, managing diabetes is achievable. So let's continue to learn, support each other, and look forward to the developments that the future may bring. To summarize our discussion on diabetes, we've explored the distinct characteristics of type 1, type 2, and gestational diabetes. We've underscored the value of early detection, the critical role of insulin therapy, lifestyle interventions, and the significance of patient education and support. We've also touched upon the latest advancements in diabetes treatment. Remember, you're not alone in this fight against diabetes. Subscribe for more interesting facts and stay tuned for our next video.